For just a moment, step with me into a scary scene. Someone that you care about is seriously ill in the intensive care unit. They're on life support, they can't communicate, and you are being asked to make their medical decisions. The doctors are coming at you with all sorts of confusing choices, you're not sure what to do, and in the midst of all that, one doctor asks you, well, what would this person want? How do you begin to answer that? Well, I'm here to tell you, you shouldn't answer that question. Not yet, at least. Let's talk about how you can take control of these high-stakes medical conversations to come to the right decision for someone that you care about. I'm Dr. Tyler, and this is How to Train Your Doctor. Alright, so when you're being asked to make a medical decision for someone else, maybe that's in the role of a healthcare power of attorney or a guardian, when things are so serious that your decisions may be a matter of life and death, a popular question doctors like to ask you is, what would this person want? The problem is that even if you know this person really well, the situation they're in is often so complicated that it's highly unlikely that you've ever had a past conversation with them about this exact situation and this exact decision that you're being asked to make. So it's hard to confidently answer what this person would want, right out of the gate at least. It may also not even be clear what's possible at this point, and it sure seems unfair to ask what this person would want if what they would want isn't even achievable, don't you think? And that's really the thing here, is that asking what this person would want right away is jumping to a choice, when what you really need to do is focus on the process of getting to that choice, which is often more important in a situation like this. So, what is that process and how do you get there? Well, starting from this point of a doctor asking you what a person would want, I would ask the doctor, where do they see things going? Again, getting a sense of the medical context here and what's actually achievable here. Are the decisions that you're being asked to make trying to buy this person years or days of life? And yeah, you do often need to touch on life expectancy in these conversations, and that can be really hard to hear. But it's also going to be really hard to make the right decision for this person if you don't have a clear sense of the trade-offs you're being asked to make by the doctors. So once you've had a chance to hear that information and process that information depending on how unexpected it is, rather than jumping right away to what the person would say they want, I would share with the doctors what this person would say about the situation as you now understand it. What you're trying to do here is paint a picture of who this person is and what they're about. What's important to them? What do they value most? What would their priorities be in a situation like this? And what trade-offs would they be willing to make or not make? Like, what are their lines in the sand right now? What would they say about living on life support for the rest of their life? What would they say about living in a nursing home for the rest of their life? Think about this in the context of the actual decision you're being asked to make. But, paint the docs a picture of who this person is as a human being. And once you feel confident that you've done that as best as you can, before jumping to your answer about what this person would want, I would ask the doctors for their recommendation. And the way that I would ask that is something like this. Hey doc, based on what you know about their medical situation, and based on what I've shared with you about them as a person, what pathway do you think is most reasonable moving forward? And see what they have to say. You don't have to take what they say at face value and run with it. Work with it until it feels like the right plan for this person. But I hope that by going through this process of getting that medical context you need, sharing a bit more about this person as a human being, and hearing that medical recommendation, well, I hope it helps you feel less like this gatekeeper of life and death and more as a conduit for a conversation between this person you're making decisions on behalf of and their medical team. Because it's a hard position to be in, to be making decisions for someone else. And with that, let me just say thank you for doing that. Thank you for being there for this person, having these really hard conversations. As doctors, we can't take the best care of patients without awesome advocates like you. So thank you for being there and doing what you're doing, and thank you for watching this video.